Hello everyone, I'm Maria with the UT School of Public Health, and today I'm going to be talking about vaccine-preventable infectious diseases in the workplace. OSHA funding and disclaimer: this material was produced under grant number SH 38960 HA2 from the Occupational Safety and Health Administration, or OSHA, U.S. Department of Labor. It does not necessarily reflect the views or policies of the U.S. Department of Labor, nor does it mention of trade name, commercial products, or organizations imply endorsement by the U.S. government. All workers have the right to a safe workplace. Raise a safety or health concern with employer or OSHA, receive information and training on job hazards, request a confidential OSHA inspection of your workplace, participate in OSHA inspection and speak in private with inspector, file a complaint with OSHA within 30 days if you have been retaliated against for using your right, request copies of your medical records, tests that measure injury and illness log. Call OSHA for assistance at 1-800-321-OSHA or 6742. So to begin our presentation, what are infectious diseases? They are diseases caused by bacteria, viruses, fungi, and parasites that can spread from person to person directly or indirectly in other ways. Humans can also become infected after exposure to an infected animal. Am I sick due to a bacteria or a virus? Bacteria are live organisms that cause bacterial infections, while viruses cause viral infections and need humans to survive. So, what are antibiotics and antivirals? Antibiotics are used to treat bacterial infections, while antiviral medications are used to treat viral infections. Now we're going to talk a little bit about vaccines. Most infectious diseases or disease severity can be prevented through vaccination. What are vaccines? Vaccines give your body a guide to fight off infectious diseases by producing an immune response similar to the one created by the natural infection. Vaccines work. This is why we don't see nearly eradicated diseases such as polio or measles anymore. So let's begin. We're going to talk a little bit about a few infectious diseases. The first one that we're going to talk about is influenza or flu. Influenza is a contagious respiratory illness caused by influenza viruses that infect the nose, the throat, and the lungs. How does it spread? The flu spreads through the air when sick people cough, sneeze, talk, or through contact with oral or nasal secretions. The symptoms include fever, cough, sore throat, runny nose, stuffy nose, muscle or body aches, headaches, fatigue, vomiting, and diarrhea. They can be mild and they can be also really severe. How is it diagnosed? It's diagnosed through tests using swabs from the nose and the back of the throat. How is it treated? Flu is usually treated with antiviral medications, not antibiotics, antivirals. How is it prevented? The best way to prevent the flu and potential severe complications is to get vaccinated every year and stay home when you feel sick. Now we're going to talk about tetanus, and tetanus is an infection caused by bacteria. These bacteria invade the body and produce a poison that causes painful muscle contractions. How is it transmitted? It's transmitted through a deep wound by contaminated objects like nails, needles, heavy machinery, dirt, poop or feces, and saliva. What are the symptoms? Symptoms include cramping, sudden involuntary muscle tightening, painful muscle stiffness, seizures, headaches, fever and sweating, as well as blood pressure and heart rate changes. How is it diagnosed? There are currently no lab tests that can confirm tetanus infection, but doctors can diagnose by looking at symptoms. How is it treated? Treatment includes wound treatment, taking antibiotics, getting vaccinated. Tetanus is a medical emergency and it does need immediate medical care. How can we prevent it? The best way to prevent tetanus is by being up to date with your tetanus vaccine and your booster. The booster is every 10 years. Now we're going to talk about tuberculosis or TB. TB is caused by a bacterium that usually attacks the lungs. There are two types of TB: latent TB, which does not cause symptoms, and active TB, which does cause symptoms and it can be fatal. How is it spread? From person to person through the air. What are the symptoms? Symptoms include a bad cough that lasts up to 3 weeks or longer, chest pains, coughing up blood, fatigue, weight loss, chills, fevers, and sweating at night. How is it diagnosed? There are currently 2 types of clinical tests to diagnose TB: skin tests and blood tests. How is it treated? It can be cured or controlled via medications. If not treated correctly or at all, TB can be fatal. Now we're going to talk about hepatitis B. Hepatitis is an inflammation of the liver caused by viruses. Hepatitis B is caused by the virus of hepatitis B. How does hepatitis B spread? It can be transmitted by contact with blood, semen, or other bodily fluids of an infected person. For example, through sexual contact, sharing needles or syringes or other drug injection equipment, or from mother to baby at birth. Hepatitis B does not appear to occur via fecal or transmission. Symptoms include fatigue, poor appetite, stomach pain, nausea, jaundice. For many people, hepatitis B is a short-term illness. Not everyone experiences symptoms. It's diagnosed with blood test. How is it treated? It can be cured through rest, adequate nutrition, and fluids. Not everyone with Hep B needs medications. How is it prevented? The best way to prevent hepatitis B is through vaccination. Hepatitis B vaccine is a series of 3 injections. The first dose is taken whenever you want. The second dose is 1 month after the first dose, and the third dose is 6 months after the second dose. Other measures to prevent hepatitis B are avoiding contact with blood or other bodily fluids, not sharing needles or razor blades with others, and discretion for intimate relationships. Now we're going to talk about hepatitis A. Hepatitis A is also a liver condition, inflammation of the liver caused by a virus. This one's caused by hepatitis A. Humans are the only natural host of this virus. How is it spread? It's caused by eating food and drinks that are contaminated with human feces containing the virus. Symptoms include fatigue, nausea, stomach pain, and jaundice. It's diagnosed via blood test. How is it treated? Rest, adequate nutrition, and fluids are used for treatment. If the symptoms are really severe, you might need medical care and you might have to go to the hospital. The best way to prevent hepatitis A is through vaccination. The hepatitis A is also a vaccine series of 2 doses. The first dose and then the second dose is given 6 months after. Other measures to prevent hepatitis A are washing your hands properly after going to the bathroom and before consuming foods or drinks. Now we're going to talk about coronavirus or COVID-19. COVID-19 is a virus that most often causes respiratory symptoms. COVID-19 may attack more than just your lungs and respiratory system. How does it spread? This is an aerosol transmission. This is a primary means of infection of COVID-19, but it can also be spread through contaminated surfaces. What are the symptoms? Symptoms include fever, dry cough, tiredness, ache, pains, sore throat, loss of taste or smell, headaches, and diarrhea. More severe symptoms include difficulty breathing or shortness of breath. How is it treated? Symptoms can be treated with over-the-counter medications commonly used for colds and the flu until the virus is gone. And how to prevent it? Following recommended prevention steps, getting vaccinated, and which is 2 doses, and your booster, and social distancing and mask wearing in public settings when there are high numbers of cases in your community or if there are sick people around you. Now we're going to talk about a few myths and facts about the COVID-19 vaccine. The first myth is that the ingredients of the COVID-19 vaccine are dangerous. This is not true. Nearly all the ingredients in COVID-19 vaccines are also ingredients in many foods, such as fats, sugars, and salts. Second myth is that the COVID-19 vaccine causes variants. This is not true. COVID-19 vaccines do not create or cause variants. COVID-19 vaccines can help prevent new variants from emerging. Another myth is that COVID-19 vaccines contain microchips. This is also not true. It's not really possible to have microchips in vaccines. Myth, receiving COVID-19 vaccines can make you magnetic. This is not true either. COVID-19 vaccines do not contain ingredients that can produce an electromagnetic field at the injection site. All COVID-19 vaccines are free from metals. Another myth is that COVID-19 vaccines can alter your DNA. This is not true. COVID-19 vaccines do not change or interact with your DNA in any way. A COVID-19 vaccine will make me sick with coronavirus. This is not true. The vaccine cannot make you sick. None of the authorized COVID-19 vaccines contain that live virus that causes COVID-19. And the last myth is that COVID-19 vaccines will affect your fertility. Currently, there is no evidence showing that any vaccines, including COVID-19 vaccines, cause any fertility problems with women or men. And now we're going to talk about monkeypox. Monkeypox is a rare infection. This infectious disease caused by the monkeypox virus. How does it spread? Monkeypox can spread to anyone through close contact with close personal contact, often skin to skin, direct contact with monkeypox rash, scabs, or bodily fluids from a person with monkeypox, or touching objects and fabrics, clothing, bedding, or towels, and surfaces that someone with monkeypox has used. Symptoms include rashes that may be located on or near the genitals or anus, and could also be in other areas of your body, such as your hands, your feet, your chest, your face, and your mouth. Other symptoms include fever, chills, exhaustion, headaches, muscle aches, and swollen lymph nodes. How is it diagnosed? Doctors can order a lab test if you have a rash consistent with monkeypox. This is done by rubbing the lesion of the rash with a swab and sending it to the lab to be treated. How is it treated? There is no current specific treatment for monkeypox. Medications and vaccines used to treat smallpox can help treat monkeypox as well. How to prevent it? Avoiding close skin-to-skin contact with people who have a rash that may be consistent with monkeypox. Those who are exposed or at high risk should also get the monkeypox vaccine. And now we're going to talk about a few easy ways to avoid diseases. The first way is to wash your hands for 20 seconds with soap and water. Covering your mouth when you cough and sneeze with the tissue and then throwing it away. Reduce your contact with sick individuals, those who are coughing, sneezing, or who have a blistery rash. Wearing your mask, your KN95 or N95 when you are sick or around sick individuals. Avoid sharing personal items like toothbrushes or glucometers. Maintaining a clean home and workplace and disinfecting frequently. And stay home when you feel sick or when you test positive. And remember, getting your vaccine is the best way to prevent infectious diseases. And we're almost done. Please raise your hand and wait for your trainer to assign you your post-test, and good luck.